interesting. Thank you. Thank you for those insights. Now, I know that when it comes to different sectors, you have the main actors and you have the non-actors. So in the health space right now, which can we identify the non-actors and what role they play to ensure that, our health status is not continually a cause for concern?
Yeah, I think it's already happening. And what I mean by that is if there was already a statement like a cause of a country of particular concern that has led us here, it means even people who were not could see a general concern with Nigeria. So now this is just bringing it down without having unnecessary, would I say, extra friction. Why that is because it affects each and every one of us. So generally, if I was to, sort of hit the nail on the head, I would suggest that. So if I would just plug a leaf from even like the Bible, where it talks about the hand cannot tell the leg, I do not need you. So sometimes more often than not, it's really this space we find ourselves. When certain problems affect one side, we tend to think of it as maybe this is a Nigerian Medical Association problem. So me, who has more of my roots even in the creative industries, is able to, leave most of what I have going on, even and say, what's going on over here and how does it affect me? So I think there's that need for a dialogue that is not exactly trying to raise threats, but just generally see how these problems affect each and every one of us.
I can definitely relate to that. So that means we all have a role to play when it comes to advocacy for the health sector, just like what you have done as a creative, but still, showing your concern for this particular country.
Very well.
Of concern here. Quite interesting insights there. Thank you very much. So I'd like to further know, when it comes to the issue of brain drain, how do you think we can go past this? We all know one of the major issues, the enabling environment for our medical personnel. How do you think we can further, tackle this? Because while we speak, and from what we have seen, other countries are creating enabling environments for our medical practitioners to have a soft landing when it comes to career. And what implication does that have to us in Nigeria and the health space?
Honestly speaking, I think anyone who kind of, I'll reference like media, anyone who works in, say, film, or anything that has to do, that appeals to human conscience, there's a cardinal rule that says don't say what you can show. So what I mean by that is we're having a brain drain problem. We don't need to tell them, come back. We need to show them why they have to, sort of be helpful in this situation. So generally, and that is an example even in what I'm also doing, right? So we don't have to exactly, just clamor to people and say, come, but we have to basically show them that, look at what we're doing to make it very favorable for you. But it doesn't help when people look at these ridiculous statistics and see what's happening. Even if they were wrong, even if the statistics were all lie, then we need to show statistics that are true, basically.
Thank you for that. And in the issue of life expectancy, it's quite alarming that for a country as we would like to feel like the giant of Africa and somewhat developed, our life expectancy is quite disturbing. What would you say are some of the contributing factors, and how do you think we can actually, get better results and progress in that area?
Actually, that's a very good question. And this is why I reference, if anyone gets to watch, which I advise most people to, if anyone gets to watch the visual essay, you see why I reference one of the ancient, what I say, lines that says, I reference a term that says, whatsoever you do to the least of my brothers. So what I mean by that is, if we're talking of life expectancy, we're considering life expectancy for all. So when I thought of particular concern for me, it's not just speaking from a place of my own comfort or knowing I'm able to access private health care or walk up to pharmacies, right? So let's say I had to buy antibiotics and I'm thinking of it, and you're thinking that, look, what's the minimum wage? How is this person able to afford it? So it's generally just, being in consideration of the least of our brothers and every other person, that, is still subjected to, this same situation we all find ourselves in. And I think that's how you affect life expectancy, in consideration of, the top to bottom of different stratas of our society.
That's a very interesting perspective on that. Just how, just in the same manner that you have come and shed light and put the spotlight in some of the gaps missing in the health sector and the health status, I'd like to know what role do you think Nigerian, the common man, can play when it comes to the health space and ensuring that, you know, our health sector actually works again and works good?
Generally, I think my last answer basically touches on that a bit, but as I would also further buttress, generally, we need to start asking ourselves the hard question. One of my previous editors told me something about he basically said, who thinks for us as a people? Who thinks for us? So it's basically not allowing ourselves, not allowing the worst examples of us to be used to judge the rest and the best of us. Okay. So it needs to be perceived and seen as community efforts when it comes down to it. So even for me, this is an example, as I said earlier, everyone across different sectors, this is not just me just being blindly optimistic. It's also my own efforts as in my own humanity to see how we can also collectively affect, also, you know, lay a different trajectory on our general life expectancy as a people.
Thank you. So I felt like the visual essay was such an expose, and sometimes the issues that we have in Nigeria is the lack of adequate data. Are you working with organizations or other stakeholders, you know, to ensure that they have some of this data? Would you be willing to carry out this sort of research for organizations that might want this to enable them proper plan and cater? I think you mentioned a very good point when we spoke about brain drain, that you wanted to give the medical practitioners something to see and a reason to want to come back. So I believe that what you have, I've had a look at the visual essay, and it was roughly 8 minutes long. I believe there's so many other sectors and gaps to fill in. Would you be partnering with organizations to be able to give more empirical research to ensure that, you know, the common man and other sectors also play a role, including the arts?
That's a very brilliant question. This is what I would say. I'm no professional. I've never been in. I'm no doctor. I'm no nurse. You know, but one thing I know for sure is, and this is why I believe the creative industries have a very significant role to play. And why I'm saying this is, if you think about it, when it comes down to even medical facilities, when it comes down to every kind of surgery, you more often than not need imaging. Mm-hmm. Imaging is a product of photography. You know, so it's what I'm trying to say is there's always a cross-pollination of different technical skills. So what I mean by that is, even when it comes down to public relations, it comes down to information technology. You know, there's always that need to, you know, sort of cross-pollinate these different services towards the general betterment of society. So I think we need to go back to the drawing board. I mean, I'm sure we hear this very often, but it will be interesting to have new, different perspectives. And I actually picked, sorry to actually interject, I picked this up, I learned this on a magazine on a flight to Abuja, and it was actually just talking about how there was more need for stakeholders across board to also, you know, put in their efforts towards this. Absolutely
amazing. Now, as we round up, I'd like to know, what is it that you wanted the viewers to get out of watching that piece? Which stakeholders were you targeting with your visual essay on the status of Nigeria's health space?
Generally, if I was to sum it up in one word, I was just basically trying to shed light on the dark corridors, which I kind of said. And I think, not to be cheeky, I said never say what you can show. So I think people should go see it and you have a better understanding as well. Let it appeal to your conscience like every work of art in its own right.
Thank you so much. Thank you so much for staying tuned to Health Digest. I hope that you had an insightful conversation. And remember, it's not just the healthcare practitioners that have a role to play when it comes to Nigeria's health space. So the creatives, everybody, jump on in there. Thank you so much. It's been an absolute pleasure. Stay blessed and not stressed. I'm Ukemra Tukwa. Peace.